Hi, I'm Greg, creator of opportunities,
And I'm Polly, Princess of Prevention.
and welcome to another edition of Totally Preventable. Welcome to another edition of Totally Preventable with Greg and Polly. How you doing today, Polly?
Good, Greg. How are
I'm
you?
doing all right. Good Friday, bright sunny morning. Any plans for this weekend?
Um, no, I don't think I do. Maybe I'll plant some seeds, get them started from my garden
That
since
is
it's
awesome.
feeling springy out.
That is awesome. I think I'm going to rake my yard. I think that's what definitely calls for this weekend because it's looking bad. A lot of the leaves on the ground.
Getting ready to mow.
Getting ready to mow. I'm going to totally prevent a lot of yard work this year. That's my goal.
Yeah, we've already mowed.
Really?
Yeah.
Already?
Growing up, I was always told you mowed on Easter. Like that was when you started your mower and you mowed. That was our Farmer's Almanac little tip. But we had to mow before Easter. Our grass was that tall.
Really?
Yep.
Wow.
Yep.
I'm way behind the ball.
Because we were totally preventing a hayfield in our yard.
Oh, yeah. I can definitely agree with that. I've got a lot going on with the allergies. That's what really prevents me from going out and doing as much as I want to do. But yeah, that's great news. Sounds like we're both going to be, using our green thumb this upcoming weekend.
Absolutely, and getting outside, getting some vitamin D.
That's right. That's right. And today we have a great a great guest coming on. We have Lori Kosicki coming from Hope Recovery Network, Hope Recovery Center.
Yep, Hope Recovery Center.
Yeah.
In Middletown.
Yeah.
Yep, always great to talk to Lori.
It is. She's one who's always out there. We see her usually advocating and a lot of these state and city meetings, town meetings, I should say. So it's going to be great. I can look forward to this interview.
Yep, she's always a great community partner and a great ally to the recovery community.
Yeah. So without further ado, ready to get started?
Let's do it.
All right. Today we are joined by Lori Kosicki. She is a certified peer recovery specialist and manager of the Hope Recovery Center, Middletown's location. How are you doing today, Lori? Thank you for joining us.
Oh, I'm so glad to be here. And thank you again for including me and inviting me to do this. We always appreciate an opportunity to share about the great work we do here at Hope Recovery Center. So again, thank you.
Thank you. I remember the first time I met Lori. It was during the SOAR. I was recruiting for the SOAR grant, the state opioid response grant. And when she came in and we met, firecracker, passionate about what she was doing, knew just as soon as I asked the question, had the answer, what her plans were for those new programs. It was a great experience. It was my first interview because I just started with the coalition, and she was my first interviewee for that grant. And I was like, wow, if all the interviewers are like this is going to be a great time.
Great way to start off.
Yeah.
Yep.
So, wow. Thank you for making my introduction into the coalition very great.
Well, you were so easy to work with and so pleasant, Greg. And I think I was a little nervous too because we were initiating the save stations at that time. And it made it very comfortable for me as well. So I'm grateful for that.
Thank you. Thank you.
Awesome. Lori, do you mind telling us a little bit about yourself and how you got started in this work?
Sure thing. So I am a person in long-term recovery from substance use and mental health disorder. And as someone who has worked really hard, and I feel I was given the gift of recovery through many attempts, efforts, and tribulations, I really wanted to work in this field, which allows me to share my lived experience, along with what worked for me and what didn't work for me. So just a little bit about my history. I came into recovery rather late. I was 50 years old, and when I finally was successful in my recovery journey. So many people get in a lot younger. I had tried many times, but due to reservations and whatever was going on with me that had to be resolved and healed. I wasn't ready till I was 50 years old. And one thing that I like to say is it's never too late for recovery. Might have been too late for law school for me, but never too late for recovery. And now that I have the privilege of being able to do this work and work in the field, why do I need to be a lawyer? I have the best job I think I've ever had in my life, and I've had quite a few jobs.
Do you feel that that drive to be a lawyer is helping you now, maybe like the advocacy and ally work that you do?
Possibly, Greg. That's a really good question. I think one of the reasons I wanted to be a lawyer is because I like to argue.
Oh,
And I like to prove points, right? So, yes, that could very well fall into the advocacy and the education part of what we do. So, I like to let people know that, addiction or substance use disorder and mental health disorder are truly a disease, right? So, when people say, well, you make choices, you know what? It's very hard to explain to individuals that are not open to receive it that we can't help it, but we can heal from it, right? But it requires work. It requires medication for some individuals. It requires wellness. And those are some of the components that we implement here. So it's a very well-rounded program and services that we provide here at the center.
Excellent. I think it's also helpful to promote that it takes time. When we promote harm reduction, a lot of people don't seem to understand that sometimes it takes several, if not more, tries to be successful in your recovery, and how important that is to give everybody that chance.
Absolutely, Polly. And, I'm sure you guys have heard many times that relapse can be part of your recovery journey. And it was for me. And that's something that we are very non-judgmental, very accepting of where people are at in their recovery. So when they come in and they say, I'm still drinking, or I'm using a little bit, or I'm this or I'm that, is when we do take the harm reduction approach and we plant seeds, right? So our goal and objective is just to help them live and sustain a healthier lifestyle. And whatever that means to them, again, it's very person-centered. They define their recovery plan.
wow. So can you tell us, as and pretend we're like outsiders looking in, can you tell us a little more about the Hope Center Recovery and like programs and services that are provided?
Absolutely. So Hope Recovery Community Center provides individuals with direct one-on-one peer support with a certified peer recovery specialist, or on occasion with interns. So we are a training ground for interns that complete the CPRS training. I currently have, I had two, I now have one, and that provides them with the opportunity to be mentored. So I train them, I teach them, they shadow. So they might sit in on some of the one-on-one direct peer support so that they can learn. And they also help in the facilitation of groups. So when they meet with a certified peer recovery specialist and or intern, there's a focus on the wellness and recovery plan of care. So again, as I mentioned, we are very person-centered, meaning that we meet them where they're at and help them define their recovery plan. So something that's very helpful that we learn in our training is active listening and motivational interviewing. So that's actually key to being present and empathetic to the needs of the individuals that we're working with. We also have a variety of groups to include NAMI, which is the National Alliance on Mental Illness. And that's for people living with mental illness. And as a matter of fact, that group is going on right now. It's pretty well attended. We also have a Women's All Recovery meeting, and that's a discussion topic related to women's issues in recovery. And All Recovery is a very open format, so there's not structure. well, I should say not structure. It's not like a free for all, but it's, you could pretty much talk about whatever your needs are, even if it's off topic. So, in addition to that, we have all recovery for both men and women, which is co-ed. And we also have smart recovery, which is self-management and recovery training. And that's CBT science-based. And that is, they utilize worksheets, and that has a little bit more structure. And a lot of individuals love smart recovery. We get a great turnout virtually and in person. And people have found it as a great alternative to either NA or AA. So we get a lot of people that come in and they say, okay, I've tried NA or AA, doesn't work for me. Either it's the spiritual piece of it that just doesn't work, or they don't like sharing in that format. So, because SMART focuses on changing behaviors, which is a big part of the recovery process, a lot of people get what they need out of it. And we have a wonderful facilitator, Alex, who was a peer recovery specialist here. He is now transitioned over permanently to the outreach team. So we have a little balance there. And we also have, we just started yoga this month, and Dharma recovery, which is based in Buddhist practices and principles, as well as wellness art. And those are all facilitated by our wellness coach at Parent Support Network, Heather Paris, and she does a fabulous job. And we also have an LGBTQ support group. And some of the other things that we provide for individuals. So we try to have a social event each month, and that social event allows people to hang out with the staff and other members. So last month we had a game day, and that was so much fun. We just sat around and played games. It really gives people the opportunity to see what it's like to live a life in recovery and still have fun. And then next week, what we're going to do is we're going to take a nature walk at Satchwis Point. So we're trying to find new ideas for things to do each month for individuals that want to stay engaged. And it also helps develop their support network, which I put a strong emphasis on when I work with individuals, is it's really important to have family members, but also other people in recovery as well to support you. And just to add on, we also support individuals in getting into treatment, be it detox or residential or recovery housing. We help them find housing and jobs, as well as taking them to various appointments. So for instance, somebody might need to get their license or their ID. We'll take them to the DMV. It could be a new agency or anywhere where they're not necessarily comfortable going and they feel that they need peer support. Yeah, so we do a multitude of things. It's basically supporting individuals in whatever their needs are.
Wow.
Great. Seems like there's a lot of opportunity, a lot of community building, and making some nice supports for a lot of people. Could you tell us a little bit about the difference between the Newport location of Hope Recovery and the Middletown location, and how that all came about?
Absolutely. So I started in the downtown Newport location in May of 2018, which is when it initially opened. And due to COVID, we had to close the Newport office in March of 2020 due to lack of space and the inability to social distance. So we had made a decision prior to that to look into an additional space in Middletown. And we were very fortunate to work with the Journey, and they had a small space available. So we were able to move in there in May of 2020, after the lockdown was lifted. We opened up gradually a few days a week. And essentially, it was almost like starting over. So we pretty much started a whole new recovery center. And, since we have moved to this location at 294 Valley Road, prior to that, we had a lot of challenges finding a location. Many landlords or other tenants didn't necessarily want us there. And I began having a problem with that.
It
And
was
that's
something I
where,
would have never thought of. I didn't even think
oh,
about that.
yep, it was prevalent. We had a couple situations where the tenant was like, nope, I'm not going to share a space with them. And people are very disillusioned, I feel, about the people in recovery, um, and as they're talking to me, I'm like, but I'm a person in recovery, the people that bag your groceries at the grocery store or check you in at your doctor's office are people in recovery. And that's where the education comes in. And that's the challenge that we have with the stigma around it. So it was very discouraging and disheartening. We looked for about a year until we were so blessed to have gotten into the Hogan building. They were just so receptive, open-minded. They've become great neighbors, great landlords, and we're just very thankful to have this space. And then probably last fall, we decided that we really needed to reopen downtown again. And the reason being is, downtown Newport is where our vulnerable population is, and we did not want to neglect them. So when we moved to Middletown, my hope was that a lot of the individuals that used to come in for services downtown would transition to Middletown. But a lot of the people were from the shelter, and that was convenient for them. It was very convenient for us to have a location downtown, whereas they'd have to take a bus, and it wasn't as easy for them. So we decided to reopen downtown, and Jonathan Sullivan, who is now the manager down there, has really connected in a very strong way with the shelter and providing some very focused work with those individuals, and they're thriving. I think they're doing a fabulous job. So now we have that nice balance. Whereas you can easily come in here and park anywhere. Downtown was a challenge with parking. But at least we have the two locations. So there's a lot of harm reduction and basic needs met downtown. And the services that we provide here are more retention based and people that have begun their recovery journey and want to maintain it. So that's why we have a variation on certain groups.
Wow. So you mentioned how, this move was pretty much brought on by the pandemic and, COVID-19 pandemic and the lockdown. How has treatment for substance use disorder and mental health disorder, how has that treatment changed with Hope Recovery since the pandemic?
Okay. Well, I believe that COVID has really brought about additional issues for individuals in general, not even just people in recovery. But for individuals that are in recovery that already have mental health and substance use disorder, the isolation was very difficult for them. And the inability to receive face-to-face supports, which many people have relied on for their recovery, their self-care, and overall wellness. We had many challenges with transitioning from in-person appointments and groups to strictly virtual, then to hybrid, and then back to strictly in-person, and then back to virtual again, and now hybrid again. So with all these upticks and surges, we've had to dance around and just try to be safe in the process and accommodate people. So we were very fortunate here because I was able to bring in a TV from home, bought a little camera. We have an external mic, so we can set it up so that everybody can see the people in the group, the facilitator, as well as we could see everybody on TV. The other centers are in the process of getting set up with TVs so they can provide it. And it's been difficult for our members who are not comfortable with technology, and most people really prefer in-person meetings. But by offering hybrid, non-members also have the ability to attend our groups from various locations throughout the state. and as well as out of state, specifically for smart recovery, because that is a national group and it's listed, it's publicly listed. So people come from Connecticut, New York. We had some guy from England join our meeting once. So I think being able to provide the option of attending either virtually or in person helps a little bit. But we've also seen people fall off when we went strictly virtual because they just didn't want to do it.
Yeah,
Does that make sense?
it does
Yeah.
make sense. We've seen it in a lot of things that we do, where we used to have good attendance and
Mhm.
people participating and helping out. We have seen attendance drop and it become more difficult to get people to join in the conversation. I know the public's perception of substance use treatment seems to be limited. And even working in the field, it seems like it's very difficult to get into recovery or treatment. There seems to be a lot of barriers. So if someone knows someone that is interested in getting treatment, getting into recovery, what would you suggest? What would be their first steps? How should they go about it?
So this question poses ongoing concern for a need for more treatment facilities and also an awareness of peer recovery specialists and their availability to help navigate this whole process. It can be difficult to navigate this process, which treatment facilities, take certain insurances, right? And that's our job to know what facilities take what insurances, what beds are available at what facilities. And the best thing to do, I would suggest, is to find a peer recovery specialist, work with one of the Hope Recovery Centers, and or an agency that works with people with substance use disorder and have them support them in the process. So say a case manager. You know, I know from our perspective, we're very involved in a lot of legislature and state meetings. So, for example, every Wednesday we're on the BHDDH call, and on that call they discuss like the threshold levels for overdoses throughout the state, as well as what beds are available here. I know there's been some challenges with the Phoenix House transitioning and ownership has changed. And so they haven't been open for detox and they have recently opened for residential beds. So we have been, that is our biggest barrier, the limited treatment facilities. And I will mention though, because we work in the field too, a lot of people call and they think that we have pull or an in and we're going to get them a bed quicker. But we don't have that pull. We're just knowledgeable about what's available and we can support them in that process. So, it just depends on what their needs are. Not everybody needs detox. They might just need residential, or they may have some sustained recovery and just need recovery housing.
So, what are some of the other obstacles that you've seen in this field of work, like in terms of helping people get into the right type of treatment?
Again, okay, limited treatment facilities and lack of beds available. When I work with individuals, there's a small window of time that a person is willing to accept treatment. And I know that from my personal experience, if I'm in a place where I've either suffered a severe consequence of my using, I'm usually very proactive in pursuing, treatment. So in the past, this is way before peer recovery specialists. So I had to do it all on my own. But after a couple of days, if I had to call for a week to get a bed, all of a sudden I'm going to be disinterested. And that's what happens. People get discouraged. We also had a facility, I won't mention any names, but that readily accepted Medicaid, and we often referred people there. It was pretty simple to get them in there. There was usually beds available. They have since transitioned to commercial insurance because commercial insurance pays more. And now they currently only have 2 state beds that in turn increase the challenge of getting people the help that they need.
Wow. Well, it's very interesting that you said the small window of time. I feel like that's not emphasized enough, especially when we're talking prevention. Thank you. Thank you for mentioning that. It's
Sure.
definitely eye-opening.
Mhm.
So there's a lot of barriers, and I would imagine there's even more barriers for youth. Um, what what opportunities are there for youth that are struggling with substance use disorder and need some supports?
So I'm really glad we're talking about this, Polly and Greg, because there's limited uh, supports. So we recently hired a director of youth services for the Parent Support Youth Program. Her name is Kayla Kudis, and so far she's just doing a fabulous job. She is just going to do amazing things, but right now she's trying to get things up and running. So our youth program will provide one-on-one peer support, kind of like what we do for adults. And I think the ages they support are from like 16 to 25 or 26. She also plans on starting youth groups, and she hopes to have those rolled out in the next few months. I also learned about the 7 Challenges program, which is implemented at Comprehensive Community Action Program, as well as Family Services of Rhode Island. And that's a counseling component of an outpatient program. And that's for youth and young adults ages 12 to 25 who are diagnosed with SUD, substance use disorder, and mental health disorder. As far as detoxes, I believe Butler Hospital provides that. I'm not entirely sure, but they do have a young adult partial hospitalization program for for youth with mental health disorder. So yeah, that's something that I find that there's more of a need on. And the more I work with Kayla, we're going to learn more as we progress and grow that particular program. So hopefully I'll have updates and be able to include Kayla in the Newport Prevention Coalition meetings as well as other opportunities.
That's awesome. We're always looking at ways to support our youth and put supports in there for them within our communities.
Absolutely.
Lori, I'm curious, what advice would you give to those in recovery on how to talk to their peers or their family or even their children about their experiences?
So I loved this question, even though I found it a little bit difficult to answer, but I think it's important. And I believe that educating people is really super important, and it helps to reduce the stigma as well, right? And it can also depend on how supportive the family members are. So I would approach the conversation with caution. So when talking with family or loved ones, I suggest only share what you're comfortable with. And it's important to feel safe and in a trusting environment, right? So I also feel that oversharing your experiences, because a lot of people get excited when they're in recovery and they're out. Okay. So they just want to share everything. They're excited, they're new in recovery. And I remember telling my kids, you guys, I'm doing great, blah, blah, blah. They're like, well, mom, you've been doing great for many years for a short period of time. So we're not holding our breath, right?
Yes.
So that's when I learned that actions had to speak louder than words.
Mm.
So, but if you're oversharing your experiences, you can also cause harm to others as well as yourself. So my suggestion is to maybe review what you want to talk about with a peer recovery specialist first, or a therapist, or if you're in AA or NA, talk to your sponsor, which is what I did before speaking with my family members about my experience, because I had to be prepared to hear some upsetting things. You may not get that response that you feel you need or want. Um, and I needed to know that I also had support So I had my sponsor and my recovery network to fall back on if I was to get triggered. And the key is to not personalize their response. So when speaking to your loved ones, have that backup support available, because you may not get the response that you think you're going to get, or the support. So, we're here to walk you through that process and make suggestions on how better to approach it.
Do you offer any family supports, any groups for families who have a loved one in recovery?
So not currently, Polly, but there is a group that in our Westerly Recovery Center, I think it's called Strong Arms, and I think it's family support. And eventually down the road, I would like to start that program here. It would just take a little bit of research. But what I have been doing is I'm working with Lori McDougall from the REST.
Yep.
She does the REST program as well as Allies in Recovery. So she gave us a bunch of toolkits and we provide them to families. I also dropped them off to the Middletown Police Department because they had specifically asked for resources for family members. And I also gave them an outline of like Al-Anon, Nar-Anon, and various family supports, even like PFLAG for individuals from the LGBTQ community as well. So, this is something that we would like to bring to the center. But I also think it's important to have the toolkits available and the resources, even though we don't work directly with them.
Absolutely. Thanks. So something that was close to the coalition's heart was getting some nalox boxes in our community. And I believe there might be 8 out there in the community.
Mhm.
And I was wondering if you could tell us a little bit about that program.
And what is a nalox box?
Sure. So, as you mentioned, Polly, that was initiated through the Code Community Overdose Efforts and through that grant, as well as the Newport Prevention Coalition. And that enabled us to provide a nalox box, which is a secured box that's installed on the wall with easy access. So it's not locked at all, but you can just easily open it. It also has in there a mask to provide the CPR, but during COVID, we were instructing people to not provide that service, but to just through training, just to administer the naloxone, which we trained them on how to use. So we provided those boxes, and James Day and I went out through the community and he installed them. He carried his little toolkit around.
I was on an installment mission one day with him.
And how fun was that?
It always involved lunch.
Right. And for me, it was breakfast. Yeah. It always has to be around a meal. So, but it was a lot of fun, and it gave us an opportunity to really connect more closely with our partner agencies. And in the placement of these particular nalox boxes, we were able to educate people who are not necessarily aware of the opioid epidemic, in what's involved. So we were able to talk to people. So one of the places that we set up a nalox box was at the daycare center at EPCAP over near CCRI. And we were able to, again, educate them and inform them of the need for the nalox boxes. So I just want to mention too that our core, which is our community outreach response efforts, our outreach team for Parent Support Network, does check on the boxes periodically, and they'll replace them if they're used or if they're expired. So we try to stay on top of it. And we just get, Narcan into the hands of virtually anybody and everybody whenever we have an opportunity.
We're trying that here as well. So.
And you're doing a great job, you guys.
Oh, and so are you. What are some things that we as a community should be focused on to foster a stronger recovery network and encourage positive change?
So I feel that ongoing collaborative efforts between agencies is really important, to bring awareness of the services that the agencies provide, and to do that through various platforms, right? Like, so through social media, I send out flyers, I update partner agencies on our services or anything that we might add or something new, um, as well as education and table events, right? So we have, Polly, you just sent me an email about the wellness fair that's coming up in May, right? So that's going to be like the kickoff for our table events, and I think that's just really important to get out in the community and support. I think supporting any initiative that encourages change. So again, that comes down to communication, right? So I love it when I get flyers or any information from different agencies that will say, "Oh, we have this going on," or "Check this out. Look what I learned." I think that's really important.
Great. Um, Thank you for joining us. Is there anything that you would like to share with us about things that maybe the community should know, or where they could go to find out more information?
So they can go to our website. It's parentsupportnetwork.org, and that will take them to the Hope Recovery website. They can also call our center at 401-324-5861, even if they just want to inquire about services or groups. We can certainly provide them with a calendar, whatever their needs are. We're happy to just speak with them over the phone if they want to come in and talk. So, and we're located at 294 Valley Road, Unit 6 in Middletown, Rhode Island.
Thank you. Lori, I have one quick question. Are there multilingual, are there peer recovery specialists at, oh, at Hope Recovery?
It's a very good question. We currently do not have somebody who's multilingual. However, at Parent Support Network, we have access to peer recovery specialists who do speak Portuguese, primarily Spanish. So we do have that option for an interpreter.
All right.
Our goal would be to have, we used to have one. I had an individual when we were working downtown who came in twice a week to work with individuals who, English was their second language. So it provided us an opportunity to break down that barrier, and make them feel more comfortable. But as of now, no, we don't. But that would be, a long-term goal for us.
Awesome. Awesome. Thank you.
Sure.